we developed caffeine-potentiated chemotherapy to improve the oncological results and limb-saving surgery in musculoskeletal sarcoma treatment. Caffeine, a xanthine analog, has a DNA repair inhibiting effects, leading to synergistic cytocidal effects with anti-cancer drugs on malignant tumor cells. Caffeine-potentiated chemotherapy has been improving limb-saving surgery for more than 20 years. From now, we'd like to introduce caffeine-potentiated chemotherapy and its recent progress.
Osteosarcoma is the most common primary malignant bone tumor. Treatment of osteosarcoma by surgery alone is associated with a low survival rate. The addition of chemotherapy has dramatically improved clinical outcomes, raising the current standard 5-year survival rate to approximately 50 to 70%. However, this trend of improving survival rates seems to have stagnated. For osteosarcoma treatment, if we can develop more effective chemotherapy, we could improve survival rate and limb function with decreasing local recurrence rate. So development of effective chemotherapy can completely change the strategy for osteosarcoma treatment. Although several enhancers were reported for anti-cancer agents, we took note of caffeine. In 1960s, caffeine was also known as an enhancer of irradiation and ultraviolet because of DNA repair inhibiting effects. So we started to investigate the efficacy of caffeine as a suitable enhancer of anti-cancer drugs. From basic research, we revealed that caffeine has significant synergistic effects with cisplatin on human osteosarcoma cells. DNA damage causes activation of ATM, ATR in tumor cell, and it finally causes cell cycle arrest to repair damaged DNA. On the other hand, caffeine inhibits ATM, ATR, and it results in cell cycle progression. Caffeine also activates p53 and suppress BCL-XL, which causes apoptotic tumor cell death. Caffeine is also known as topoisomerase I inhibitor that is necessary for DNA repairing. Topoisomerase I causes the untangling of DNA supercoiling for DNA repair. Caffeine inhibits topoisomerase I, leading to no untangling. The mechanism of synergistic effect of caffeine is complicated. However, in nature, it is reported that this results from ATM and ATR inhibition by caffeine. Here I summarize the mechanism of caffeine enhancement. Each cell has standard cell cycle. Generally, the tumor cell that is damaged by anti-cancer agent prolongs S and G2M phase for DNA repair. After the repair, the recovered tumor cell divides and tumor progresses. However, caffeine forcibly advances cell cycle. The damaged tumor cell cannot repair its DNA and causes mitotic failure, and tumor cell will die. Fuchi is a fluorescent protein expression technique that can visualize cell cycle. After treatment of cisplatin, the cell cycle is uniformed. Almost all cells show green fluorescent, that means cell cycle arrest for DNA repair. However, additional treatment with caffeine, the cell cycle is not uniformed. Red fluorescent color is also observed. We have already confirmed that several anti-cancer agents were enhanced by caffeine. Of course, newly developed anti-cancer agent that has DNA damaging mechanism might be also enhanced by caffeine. Generally, we administer anti-cancer drugs and caffeine via artery because of expecting higher local concentration. We insert the tip of the catheter into the vessel distal to the last musculoskeletal branch, not contributing to the blood supply. Since 1989, we have utilized caffeine-potentiated chemotherapy in clinical practice for treatment of high-grade bone sarcoma. Our protocol for neoadjuvant chemotherapy begins with 3 to 5 courses of intra-arterial infusion of caffeine combined with cisplatin and doxorubicin at 3-week intervals. The effectiveness of chemotherapy was evaluated using plain X-ray, angiography, MRI, and thallium scintigraphy. If the results of 2 or more imaging examinations show effectiveness of the treatment, we perform intentional marginal excision. For high-grade soft tissue sarcoma, we also start with 3 to 5 courses of intra-arterial infusion of caffeine combined with cisplatin and doxorubicin at 3-week intervals. In all variants of our protocol, we administer a major tranquilizer, chlorpromazine hydrochloride, to our patients to reduce possible caffeine-induced sleep disturbances. Also, to prevent severe adverse effects, we monitor the serum level of the 3-day course of caffeine at 24, 48, and 72 hours after the start of continuous infusion at a dose of 1.5 grams per meter squared per day. We calculate the appropriate infusion rate for the final day of caffeine infusion using a 1-compartment constant infusion model based upon the serum levels measured at 24 and 48 hours. In our series, all patients could achieve adequate caffeine concentration without over the critical concentration level. Caffeine is possible to change the chemotherapeutic effect. For non-responder of chemotherapy, caffeine cannot change the efficacy. Because caffeine itself is not an anti-cancer agent. However, for NC responder, caffeine might change chemotherapeutic effect to CR or PR, and PR responder to CR. Caffeine enhancement depends on magnitude of DNA damage induced by anti-cancer drugs. Caffeine-potentiated chemotherapy can change surgical margin to preserve limb function. Of course, surgical resection with wide margin is requested for non-responder of chemotherapy. However, for favorable responder of chemotherapy, it is feasible to minimize surgical margin to preserve healthy tissues as much as possible. In days gone by, it was said that great surgeon, great incision. Nowadays, great surgeon would minimize invasion to preserve QOL. In stage 2B, without lung metastasis patients, effectiveness rate of caffeine-potentiated chemotherapy is more than 90%. High incidence of total tumor necrosis can be obtained. Oncological result of these patients is excellent. 5-year event-free survival rate is 74% and overall survival is 93%. Only 3 patients died of metastatic disease. However, 5-year overall survival rate is less than 30% in stage 3 with lung metastasis patients. The improvement of the clinical outcomes in stage 3 patient is a problem to be solved. Case presentation. 11-year-old girl with osteosarcoma of the left proximal tibia. Caffeine-potentiated chemotherapy was significantly effective and we performed hemicortical resection. Tumor-bearing bone was resected with intentional marginal margin. Tibia articular surface and patella tendon was preserved. The resected bone was treated by liquid nitrogen and replaced to the original site and fixed with iodine-coated titanium implant. Excellent bone union and limb functions is achieved. Her knee joint function is completely preserved. There is no limitation to her daily life. She enjoys sports activity with her friends. This case is 12-year-old girl with osteosarcoma of the left proximal tibia. Caffeine-potentiated chemotherapy was significantly effective. Complete response was expected. The tibia articular surface was preserved and tumor-bearing bone was treated by liquid nitrogen using pedicle freezing technique. This is an operative plan. Osteotomy lines were confirmed by fluoroscope. These are intraoperative views. The elevated bone was completely isolated from surgical field by surgical seats. The tumor-bearing bone was treated in liquid nitrogen for 20 minutes to kill osteosarcoma cells. The treated bone was completely frozen. The treated bone was replaced to the original site and fixed with iodine-coated implants to prevent surgical site infection. The resected specimen showed total necrosis. Complete bone union was already observed at 10 months after the surgery. Her knee joint function is excellent. She has no limitation of her activities. This case was 14-year-old boy with osteosarcoma of the right tibia. The resected part was reconstructed using distraction osteogenesis technique. 12.5 centimeter bone defected was reconstructed with bone transport. Range of his knee joint motion is full without extension lag. He can run much faster. Five-year-old boy with osteosarcoma of the right proximal humerus with pathological fracture. Caffeine-potentiated chemotherapy was significantly effective. We performed intentional marginal resection and reconstruction with vascularized fibula graft. This is resected specimen and grafted vascularized fibula. The grafted fibula was fixed by external fixator. 5 months after the surgery, the grafted bone has already hypertrophied. There are no limitation of his shoulder motion. Clinical outcomes for soft tissue sarcoma. So far, caffeine-potentiated chemotherapy has been performed for more than 100 malignant soft tissue tumors. Malignant fibrous histiocytoma is the most common disease in this series. Good radiological response was observed in 57.3% and good histological response was observed in 36.8%. Totally overall response rate was 61.8% in this series. The 5-year overall survival rate in patients with no metastasis cases was 82.3%. This result was superior than our historical control. 47-year-old woman with MFH of the left shoulder. Caffeine-potentiated chemotherapy was judged significantly effective on MRI, angiogram, and thallium scan. This case was 57-year-old man with leiomyosarcoma of the right shoulder. Caffeine-potentiated chemotherapy was significantly effective. 53-year-old man with clear cell sarcoma lung metastasis. After caffeine-potentiated chemotherapy, lung metastases were completely disappeared. This case is in the condition of NED for 13 years. Clinical outcomes for cancers. Sometimes metastatic bone tumor seems primary bone sarcoma because of undetection of the original site. We performed caffeine-potentiated chemotherapy for lung cancer, breast cancer, or even for lymphoma. In each case, chemotherapy was effective. 51-year-old woman with metastatic pelvic tumor from clear cell carcinoma of vagina. Metastatic tumor mass was extremely decreased after caffeine-potentiated chemotherapy. This case was 56-year-old woman with metastatic pelvic tumor from breast cancer. In this case, huge tumor mass was significantly decreased after caffeine-potentiated chemotherapy. After hemipelvectomy, the resected bone was treated by liquid nitrogen for 20 minutes. The recycled bone was perfectly fitted to the original site. 4 years after the surgery, the hip joint space is slightly decreased but still preserved. Caffeine-potentiated chemotherapy, next step. Gene therapy might enhance the effect of caffeine-potentiated chemotherapy. We already confirmed that p53 gene transfection enhances the cytocidal effect of cisplatin and synergistic effect of caffeine in tumor cells. Caffeine accumulation specific in tumor cells is a key to obtain better chemotherapeutic effect without increasing complications. We develop liposome-encapsulated cisplatin and caffeine. Liposome has a unique character and it selectively accumulates tumor cells. We have already confirmed higher accumulation of cisplatin and caffeine at tumor tissue after administering of lipocisplatin and lipocaffeine. These new agents have strong affinity with bone and also have synergistic effect with caffeine. In the near future, we want to start phase 1 trial for clinical use.
I'm sure you enjoyed the history and present status and the future possibility of caffeine-potentiated chemotherapy. With caffeine-potentiated chemotherapy, we are able to improve the survival rate and limb-saving surgery in musculoskeletal sarcomas. It will be of great value for you to try caffeine-potentiated chemotherapy for the progress of musculoskeletal sarcoma treatment. Thank you for your listening.